I'm Dr. Jim McDonald, Medical Director, Rhode Island Department of Health.
I'm Dr. Phil Chan. Welcome, everyone.
Thank you for educating the public and our partners about COVID-19. Let's just talk a little bit about COVID-19. Dr. Chan, how did we get into this pandemic in the first place?
Yeah, it's a great question. I mean, it's hard to believe that we're over a year into it now. And I'm just, I remember being in New Hampshire, actually, when I got that call about that first case. And, it just seems like it's been forever.
Yeah, it does for me. It's funny, the virus started, the SARS-CoV-2 virus started, we think in Wuhan, China. That just in a market is what happened. And when you think about what happened, it's a new infection, a new virus. What happens is it could have happened anywhere in the world. It could have been anywhere on the planet that a new virus just happened to be created, and it just infected people. And the reason why that's an important point is not every new virus infects people. Some just infect animals, but this one infects people. And that's really what got it all started, isn't it?
Yeah, I mean, I think we've learned some incredible lessons during the pandemic, and I think we're going to talk about some of those in terms of what have we learned about how to protect yourself and others from this. And I think one thing that I've learned to appreciate about everything, and we'll touch on some different topics, but it's really this concept of ventilation. I mean, if you take anything away, just know that if you do it outdoors, it's going to be a lot safer no matter what you do compared to indoors. And that could involve even cracking a window in the room. Just that open air ventilation is really key.
Yeah, ventilation is important. There's an old expression in medicine, the solution to pollution is dilution. And it really gets to that point. If you're indoors in a small confined space with multiple people and someone happens to be carrying the virus, that's one of the things about SARS-CoV-2 that made it able to become a pandemic is people spread the infection without symptoms. So just say you're in a small home, someone is just walking around their house doing what they normally do, but they're actually shedding virus. But if the windows aren't open and there's not great ventilation at home, it's far more likely everybody in the home is going to get the same infection. This is why ventilation is so important. Some inexpensive ways to improve the ventilation in your home is one, crack windows open a couple inches just all over the home. The other thing too is check your heating and ventilation system, make sure it's working properly. And that's another thing it's important to do. If you have a fan, blow it outside your house if at all possible. As the weather gets warmer, that's going to make more sense to people. But really, one of the things I also think about with this pandemic, Dr. Chan, is it a preventable disease? Like, is SARS-CoV-2 preventable? And if it's preventable, how can we prevent it?
It is preventable. And I think as we've learned during the pandemic, this is spread by a virus. The virus tends to be spread most commonly through droplets. And that's why that 6 feet rule exists. So you're most likely to spread this in someone who's closer than 6 feet because it's really spread when you cough or sneeze or exhale, and this virus travels on those particles that you exhale that can be transmitted to others. The other thing that we've learned during the pandemic is that there is a little bit for this virus to be transmitted airborne, and that means across a room potentially, which is why ventilation is so important. It's so that you can dilute the air around you. So primarily spread within 6 feet. That's why you're considered to be in close contact is if you're within 6 feet of someone for 15 minutes or longer within a 24-hour period. But we do know that there is some propensity to be spread in confined spaces without adequate ventilation.
Dr. Chan, being 6 feet apart is important, but most people don't walk around with a tape measure. I didn't even bring mine today, but one way I think you can easily know you're 6 feet from people is just extend your arm. And we can almost touch, but so this is about 6 feet apart, nose to nose, and that's what we're looking for. I think it's important to do that. Of course, another strategy about preventing COVID-19 is wearing a mask. Now, I have a lot of high quality masks in front of me. This happens to be one in particular, but the whole point about wearing a mask is if I wear a high quality mask, if I were to be shedding virus, I'm not spreading to other people. Now, you might say, I don't understand how people could spread virus. So if you've ever been in a New England winter morning, you've gone outside in the first part of the day, and you walk outside and you exhale, you see respiratory droplets come out of your mouth and they form a little vapor in front of you. You see them. They're actually freezing at that point. That's an example of you just exhaling respiratory droplets. When you wear a mask, you shouldn't see that. It's something you might have noticed when you were a kid. You used to go outside and wear a scarf. You'd notice it kept your face warm, but you didn't actually see your breath anymore. That's just a reason why we wear masks. Now, Dr. Chan, I need a little bit of hope though. Tell me a little bit about hope for this pandemic here. We've got some vaccines. What are your thoughts on the vaccines?
So the vaccines are incredibly protective. In fact, they were really best case scenarios. If you look at the first two vaccines that were approved, the Pfizer and the Moderna, 95% effective in preventing disease with COVID-19. It's really best case scenario. And that's the way that we're going to end this pandemic, is for people to get vaccinated. So encouraging people for sure to get vaccinated to protect not just yourself, but others around you, those in your household. And I feel like we all know someone who's potentially at risk of getting severe COVID.
Yeah, and apart from the vaccine, COVID is a treatable disease now too. It's been over a year in Rhode Island since patient number 1, but it's treatable. Back in November of 2020, monoclonal antibodies became approved through an emergency use authorization. So if someone does have COVID, they should talk to the doctor about getting treated with a monoclonal antibody through an intravenous infusion. Dr. Chan, I want to end on a hopeful note though. What is one thing you've learned about the pandemic and just how we all desperately need each other in this country? What are your thoughts on that?
Yeah, I've really been impressed here in the state of Rhode Island. I think there's been a lot of chaos about this virus. I think we've seen it a little bit on a national stage and certainly international stage. But I've been impressed with Rhode Island's response. I feel like we've really come together, across the entire state. The National Guard, unsung heroes, healthcare community, the state, across all departments. I've been impressed about the togetherness of the state in addressing this.
It reminds me of this old term called social contract. One of the things about social contract is we all desperately need each other. So there's certain things that we all just do as part of our culture, but one of the things I think we've all realized with the pandemic in the United States is it really is in everyone's best interest to get the pandemic eliminated in the United States, because we freely move between states. The virus doesn't care about our state lines. The virus just simply wants to replicate. It wants to find other hosts and replicate. As a member of Team Human, as I'm fighting Team Virus, I want to do my part to make sure that I'm protecting myself and others and not spreading virus. So that means when I'm outside in public, I wear a mask. When it's available for me, I get a vaccine. And then if I did get COVID, I would elect for treatment. And that's how I would do my little 3-prong approach, as well as being 6 feet apart from others. Dr. Chan, any final thoughts?
Yeah, so just with everything you said, also reminding people that if they're sick, they should not go out. That's another important symptom screening, making sure that if you're sick, you should stay home. Avoiding large social gatherings still at this point in time. There's concern for the variants. Still want to limit and be careful about the number of people that you interact with. And then also hand hygiene, making sure to wash your hands when you're around other people, making sure to clean surfaces, etc. So these are the things that you can do, and with all these things together, we're going to end this pandemic.
So I want to thank you for all you're doing in Rhode Island to help share the best evidence we have. If you're looking for places to find reliable information, if you need to get a test, go to portal.ri.gov on the internet. Another place to find reliable information is the Rhode Island Department of Health website. Just search the word COVID. We got a bunch of information there. One other place you can find reliable information about the pandemic is cdc.gov from the Center for Disease Control in Atlanta, Georgia. Thank you. I'm Dr. Jim McDonald, Medical Director, Rhode Island Department of Health.
And I'm Dr. Philip Chan. Thank you everyone for your work.